Support for this podcast comes from the law firm of Davis Malm. Whether you're a developer, property owner, manager, or commercial tenant, their real estate attorneys know the lay of the land, not just the law. Learn more at davismalm.com.
WBUR Podcasts, Boston.
I'm Daryl C. Murphy, and you're listening to The Common. WBUR senior health reporter Priyanka Dayal McClusky, welcome back to The Common.
Good to see you again, Daryl.
Priyanka, ahead of our conversation today, I did a little experiment. I called the local medical center to see if I could get an appointment. When I got through to somebody to schedule an appointment, they told me there were no openings and they put me on a wait list. Now, bear in mind for folks, I only made this one phone call. But I figured it would be a good way to paint a picture for what we're about to talk about today, which is that a nonprofit group, Massachusetts Health Quality Partners, surveyed people on their experiences with primary care physicians in the state, and they found that access to primary care doctors has been declining for 3 straight years. So, Priyanka, you've been covering this, and I want you to tell us more about the survey and what's behind the decline.
So the survey that this group does, they've been doing it every year since 2005, and they've never seen this kind of decline in access that people are reporting now. So what you just described, Daryl, people are calling, trying to get appointments with primary care providers, and they're often having to wait weeks, months, or even longer, depending on what kind of appointment they're looking for and what office they're calling.
So what's behind it?
Yeah, there's a lot of different factors at play here. So for a long time, people have recognized that there is a shortage of primary care providers in this state and country. I'm using the word provider because it's often a doctor, but also nurse practitioners provide primary care. And then you have the pandemic hit, and it is a really hard time for doctors and for other healthcare workers. A lot of people are cutting back hours. They're maybe changing jobs even. A lot of office staff are needed to make a doctor's office run. Some of these staff have decided to move on to different jobs. So there's a staffing shortage already, and then that's gotten even worse over the past few years, and that is definitely affecting access for patients.
Priyanka, do you have any kind of data that could give people a sense of just how bad this is?
Yeah, so there's already a recognized shortage of primary care providers, and there are estimates that by 2033, there'll be a shortage anywhere from 21,000 to 55,000 primary care doctors. So that's how many doctors we might be short
in
nationally.
Less than 10 years. I guess back to making that phone call to get that appointment to see your primary care physician. How long is the wait for an appointment typically here in Massachusetts?
That's a great question, and it doesn't have a simple answer. But a lot of practices, if you have an urgent issue, they will have same-day appointments available. If it's not an urgent issue, it could be weeks, it could be months, and it could be even longer, unfortunately. So Barbara Rabson is CEO of Massachusetts Health Quality Partners, the group that did this survey we've been talking about, and here's how she describes it.
People wait a long time to get a hold of primary care offices. When they do get a hold of them, they're told, they're booking months out. I mean, particularly for new patients, I've heard many stories about patients being booked the next year.
Is Massachusetts a standout when it comes to this kind of lack of access to primary care doctors, or is this a national problem?
This is definitely a national problem from everything that I've read and from people I've talked to. We're not alone in this problem.
Okay. Well, Priyanka, we're going to take a quick break. But when we get back, I want to hear more about how this affects people who are seeking care, and also how are the doctors themselves feeling. So we'll be right back.
Did you kill Marlene Johnson?
I think you're one of the first people to have actually asked.
From WBUR and ZSP Media, this is Beyond All Repair, a new podcast about an unsolved murder that will leave you questioning everything.
Somebody should be in jail for murdering my sister.
A woman who's never been believed.
As long as they think I have done this, then they're not looking for who actually did this.
And that's what makes it a cold case.
No, it's a botched case.
And a search for the truth, once and for all.
Wow, it just gets more interesting.
Beyond All Repair. Listen and follow wherever you get your podcasts.
Be careful. You're digging in a place that's been very peaceful for a while.
Do it anyway. Dig.
And we're back with senior health reporter Priyanka Dayal McClusky. So Priyanka, we are talking about a survey from the nonprofit group Massachusetts Health Quality Partners that has found that access to primary care doctors has been declining for 3 straight years. And we've been talking about what's behind that. But I want to know what happens when people can't see a primary care physician.
So sometimes when people can't get into their primary care office, they just go without care. They just kind of hope for the best, hope whatever is bothering them doesn't get worse. Probably not a great strategy, but I think we're all guilty of that sometimes.
Oh, yeah.
And then other people will end up going to an urgent care center, or they may end up at the emergency room. And that's not pleasant for anyone. Usually, there's often long waits at the emergency room. It might not be the right place to go if you have a milder health problem. Definitely the right place to go if you have a serious emergency. But it's just not a great situation. And one of the doctors I talked to, Aaron Bornstein, he's in the southeastern part of the state. Here's what he said about it.
When I see patients who otherwise could easily be managed in our office, and frankly be better managed probably in our office, going to the ER repeatedly for what would be mild complaints, and I think about how much cost that is, how much time that is for the family, and how inefficient it is in terms of the medical care. It's just not how the system should function or operate.
It's been really hard for a lot of doctors. For Dr. Bornstein's practice, for example, they've had trouble just hiring enough staff to extend their hours. So that's been a challenge for him. One of the doctors I talked to is Chloe Campbell, and she works up in Salem. I got to spend some time with her while she was seeing patients one afternoon. And she told me that she works long days. She tries to keep up with the messages, the questions coming in from patients, and she really tries to make herself available.
I feel like I have to make myself accessible to them because they are going through a lot. And I just have to put myself in their shoes.
Dr. Campbell is a pediatrician, and she sees patients from newborn babies all the way up to teenagers getting ready for college. But, even she said she has to put limits on the number of new patients she can see because it's not sustainable to work, 12 hours a day all the time.
I will take brand new babies who are siblings of patients who are already mine, but I have no room to take a brand new patient because I was having days where I would start seeing a patient at 7 a.m. and sometimes I was leaving at 7 p.m. and it was unsustainable.
And I guess this is one of those situations that could lead to a physician feeling like, okay, I don't want to do this anymore. I'm closing up my practice.
A lot of physicians are dealing with burnout. They are working long hours and they're feeling like they're not able to get to all the patients they want to get to. This is also a problem that's been going on for years. And again, something that got worse during the pandemic, burnout just increasing. And for primary care doctors in particular, they have often long days, a lot of different issues and different ages of patients they're seeing. And also their compensation is lower than physicians in other specialties. And that's definitely an issue that people point to when we talk about, why is there a shortage of primary care providers? And a lot of people argue that they need to be paid more and this job needs to be more attractive and, invested in for the important work that it is.
So how much of a difference in pay are we talking?
So there's some national estimates that someone who specializes in family medicine, which is a kind of primary care doctor, makes around $250,000 a year. But a lot of specialties like radiology, surgery, oncology, those doctors might make, almost double that.
So Priyanka, is there anything being done to help remedy this situation?
There are people calling for greater investment, basically more dollars, more spending on primary care at the state and national level. And they say that if we pay primary care providers more and give them more money to do more things to take care of patients, that could go a long way to improving access and keeping people healthier. So there's legislation pending right now in Massachusetts, and we'll see where that goes.
Priyanka, thank you so much for coming through and talking to us about this, because this is something that, hits home for me, right? I haven't had a checkup in like 2 years. So thank you for this story. I feel affirmed in my experience. So I appreciate you for doing this.
Good luck getting an appointment, Daryl.
That's WBUR senior health reporter Priyanka Dayal McClusky. And that's our show for today. Thank you so much for listening to The Common. If you like what you're hearing, head on over to wherever you listen to podcasts, especially Apple or Spotify. Rate and review us. Let us know how you're loving the show. We would really appreciate it. Also, if you want to get in touch with us, hit us up on Instagram at WBUR The Common, or send us an email at thecommon@wbur.org. I'm Daryl C. Murphy, and I will talk to you tomorrow.